East Texas Live on KTK. Well, last week, during the violent storms that hit East Texas, there was a dramatic rescue of a toddler and baby from an overturned SUV in water.
Now, rescuers started a life-saving effort while waiting for emergency responders. Now, joining us to remind us how to do CPR is Vicky LaMay with ETMC EMS. Good morning.
Good morning.
Good morning.
And so we saw that dramatic video, and plenty of East Texas saw that video. In case something like that were to happen, what are the first steps someone should take?
Well, a drowning victim is slightly different than someone that suffered a cardiac arrest due to some other kind of event. A drowning victim, it's important to give breaths along with the chest compressions because they're pretty much asphyxiated. They lost all the oxygen in their system. So compressions and breaths are important in that kind of situation where hands-only CPR, which is what American Hard Red Cross has been teaching for here recently, it's important if you really don't want to put your mouth on the victim.
And in that video, they had a baby and a toddler. I mean, is there a difference in the way CPR is performed?
Just a little bit of a difference. So with an infant, you want to do, with an infant, toddler, or adult, the chest compressions are on the lower half of the breastbone. With an infant under a year of age, is 2 fingers on the bottom half of the breastbone. And that's just going about 1/3 of the depth of the chest. And then the breath is 30 compressions and 2 breaths. Make sure you tilt the head back. Be really careful how much air you put in an infant. You know, their lungs aren't that little, so just enough air to make the chest rise. On a child, like this mannequin, it's the same as the bottom half of the breastbone, but you can use one hand instead of the fingers because their chest wall is a little bit
And you
big.
want to hit, I mean, how hard do you want to be pressing down?
You want to press about 1/3 of the depth of the chest on children and infants because the heart is kind of nestled in between the lungs. It's not right up against the breastbone. So, I mean, pretty much you want to go pretty far in. It's 1/3 of the depth of the chest, and then the same with the breaths. Tilt the head back and give just enough air that makes the chest rise. And with an adult or a large child, you can use 2 hands on the bottom half of the breastbone again. And it's 30 compressions and 2 breaths.
Now, some people, when they see that and they see how far, you know, how deep you go, they worry, you know, what if I cause more harm to the child? Is there really a concern there?
Well, there's a possibility, although with children it's not as big of a possibility as with adults, that you might break something, but this person is dead. Now, they can be dead with intact ribs, or they can be alive with injuries that can heal. It's all about trying to bring that person back. They can spend a little bit of extra time recovering in the hospital, but if you did the chest compressions and gave the breaths, they'll be in the hospital recovering versus, you know, not coming back at all.
So where can people go to become CPR certified then?
Well, there's different things that you can do. American Heart Association, American Red Cross websites have places that you can go and research. We teach those classes as well. We teach some classes, certification classes that there's a small charge for, but we also teach some classes for free. You can go to our Facebook page, or you can contact us at emseducation@etmc.org. And we can give you that information. Again, we teach certification classes at a small cost, but free classes, we teach those as well.
You're still getting the basics.
You're still getting the information, you're just not getting that card.
Now, who should really know or train to learn CPR?
Everybody. I've taught children as young as 8 years old.
Wow.
So, you know, 4th, 5th graders all the way through adults. I think everybody should learn. Now, what can also happen is if you can call 911, our dispatchers are trained to tell you what to do over the phone. So if you can call 911, put your phone on speaker, and tell them what's going on, they can walk you through the steps because that's a chaotic situation. You could forget, but once you get started, all that stuff that you learn will come back. And even if you don't know, they're very specific instructions that they give over the phone.
Okay, thank you so much, Vicki.
Thank
Important
you.
info.